So, what are some physical changes that affect older adult sexuality? For women, with menopause, there is a decrease in estrogen, which leads to a decrease in the size of the vagina and vulva, and loss of fat pad near pubic area, which can make skin to skin contact painful during intercourse. Older women are no longer afraid of pregnancy post-menopause, which leads to reduced condom use during sex. As women age, they experience decreased or delayed vaginal lubrication, which can make intercourse a bit uncomfortable, and their vagina starts to thin, particularly the tissue, which can create microscopic tears during intercourse and can create a pathway for STDs and HIV. In one particular study, 43% of older adult women reported a decrease in their sexual desire. For men, erectile dysfunction is a common health concern that affects 1 in 5 men and increases with age. This encompasses fewer and weaker orgasms, decreased ejaculation, and increased refractory periods after ejaculation. At the same time, older men reported that elevated blood pressure, diabetes, prostate enlargement, and cancer inhibited their sexual activity and interest, or they experienced something called widower's syndrome, which is the difficulty in achieving erection due to guilt of pursuing a sexual relationship after the death of a spouse. Because of erectile dysfunction, many men will seek treatment to resolve impotence. However, with an increased sexual libido coupled with limited age-compatible partners, many older men seek sex workers for pleasure. This practice can put older men at a heightened risk for sexually transmitted diseases such as HIV. In terms of physical changes for both men and women, there are specific age-related physical changes. This encompasses things that happen with the natural progression of age, such as chronic illnesses, such as chronic pain, medication interference, cognitive impairment, diabetes, cancer, Parkinson's disease, etc. In addition, the elderly are often misdiagnosed since many of the HIV and AIDS symptoms are masqueraded as part of the aging process. As a result of this, many older adults may die of AIDS-related complications without ever being diagnosed. Depression. Depression has a profound impact on an individual's sexual desires across the lifespan, and depression is something that increases with age. So, what are some social changes that affect older adult sexuality? There is a large group of widowed, separated, or divorced persons within this age group. Many older adults who are re entering the dating scene after a long term relationship may not realize the importance of condom use in their new relationships. Poor physician to patient conversations. Physicians often fail to inquire about their older adult patients' sexuality and miss key opportunities for engagement and education. This is a result from HIV test recommendations that are only for adults and sexually active persons 13 to 64. So that fails to recognize that people older than 64 are also at risk of HIV and should also be recommended to get tested at that age. In a survey of 135 physicians, it was found that 60.8% of physicians rarely or never discuss HIV or AIDS with patients over 50. And that can be really problematic considering all that we just discussed. Lack of education on sexual health risks. So older adults tend to disassociate themselves with the risky behaviors because again, they believe that only young people get STDs, or some may believe that. But the thing is, older adults of today were once the younger adults of the 60s sexual revolution. Some of the same practices that they may have utilized when they were younger still carry on to the older adult age. In addition, they also lived through the era of sexual repression, where there was a lack of sexual health education. So, in thinking about a chrono system, for example, generations of today know a lot about HIV education because it's something that's pervasive. As compared to the old adults of today, the education, well, sexual health education didn't really include a lot of HIV prevention and education, and STD prevention education. So again, there's a difference in education there, which can also put them at risk. And also, beliefs about conspiracies exist in older adults because their lifespans encompass both the beginning of the epidemic, when HIV was most highly stigmatized, and when overt discrimination was socially acceptable. And lastly, advances in HIV treatment. So that means that older adults who were diagnosed, let's say in the 80s, are living to today. So that means that the population is increasing with people who are older and who are also HIV positive. So that when thinking about older adult dating population, that's something that has to be in consideration. And lastly, the largest population of HIV positive individuals are 50 years and older, as I mentioned before. So in this age population, they may experience something called pill burden, which is the fatigue from taking different medications, which may interfere with their HIV treatment adherence. So thinking about the average older adult who may have diabetes, who may be also dealing with cancer, and let's say who also has HIV, they may be tired of taking 6 and 7 pills a day, so they may choose to reduce their use on one particular medicine because it makes them feel bad or makes them feel sick. That also can put their HIV at a heightened risk for failed adherence. So recommendations. I recommend that we have a more respectful and inclusive perspective on older adult sexuality. According to the Harry and Jeanette Weinberg Center for Elder Abuse and Prevention, when we mistakenly view older adults as asexual, one of the most extreme forms of ageism, we in fact deny part of their humanity, and for those of us who work with aging and elderly populations, we fail to support their life choices. This is something that's really important to us as future social workers. I also recommend improved physician to patient conversations surrounding sexual health. Physicians can use these crucial conversations to assess their clients' sexual health needs and concerns and improve on their sexual health. This can be done through a person-centered and respectful lens. This can be done through recommending masturbation for older adults who are cognitively impaired or without a partner, or they can also provide lube and condoms to their older patients. I would also encourage the older adults in your life to talk to their doctors and trusted professionals surrounding their sexual health needs and concerns. So that's something that you can do in your own families or in your own communities, is to help older adults feel encouraged and empowered to talk to their doctors about it. Because again, that's what the doctors are there for, is to help them with their health needs. As opposed to having routine testing guidelines limited in ages 13 to 64, it should be expanded to all sexually active persons. So as I mentioned before, older adults continue to have sexual experiences even after age 65. So it's kind of counterintuitive to stop recommending HIV testing at that age, considering all that we know. LGBTQ sensitive conversations and education for older adults. Unfortunately, older adults are often assumed to be heterosexual. It is important to include their sexual experiences of LGBTQI older adults in conversations and education surrounding sexuality and sexual health. In terms of HIV, for example, there's virtually no public health campaigns catered towards women who sleep with women in terms of HIV because the perceived low risk, although there is an extremely low risk, there has been one reported case of women's to women's sexual transmission of HIV. And lastly, privacy for older adults living in nursing and assisted living homes. Arrangements for privacy must be made so that the dignity of older adults is protected during sexual activity. So that can be done with, let's say, the children of parents who may have the rights over their parents in nursing homes, to maybe have a healthy conversation with their parents talking about what are some of their needs. Because again, it's interesting that, as we age, it seems similar to how our parents may have governed us when we were teenagers. But the difference here is that these are older and potentially consenting adults. We should give them that same privacy and dignity and respect to make decisions for themselves and their bodies. Thank you so much for listening to my presentation, and I hope that you learned something new about older adult sexuality. And I implore you to talk to the older adults in your life and encourage them to find someone, a trusted professional, to talk to about their sexual health so that they can continue to have fulfilling, romantic, and intimate experiences as they continue to age. Thank you.